Hi guys, and welcome to another video. In this video we're going to talk about first aid equipment that can help us during CPR. Now before we actually dive in and talk about the actual equipment, let's go back a bit, all the way back to AVPU, which you probably remember and you're probably sick of hearing that A means awake and V means reactive to voice and P means reactive to pain. However, right now I would like us to talk really quickly about why do we actually do this thing? Like, why do we check if he's reactive to pain, if he's reactive to voice, if he's unconscious, if he's awake? And the reason we do this, first of all, is, well, we want to make sure that he's unconscious. But there are also other reasons. If a person is reactive to voice or he is reactive to pain, that means for us that he is vaguely conscious. In other words, that means that he lost some of his reflexes, but not all of his reflexes. And if he is completely unconscious, that means he lost all of his reflexes. Okay, so why do we care about his reflexes? Why do we care if he lost his reflexes or not? Well, at the end of the day, reflexes are what keeps our body safe. They're there to defend our body from different things. And I would like to give you an example for this. You know what happens when you accidentally touch something extremely hot? Like when you touch something really hot by accident, what happens to your hand? Do you keep touching it and then you, like, after a few minutes you look at your hand and you're like, oh, this is hot, I should take it out? Or what happens is you immediately take your hand out and only then you noticed that you actually touched something that was hot. So that is basically a reflex. Reflexes make sure that they defend our body, and what happens is we first react and only then we understand what actually happened. That is the definition of a reflex. And now when we're unconscious, we absolutely have none of those reflexes. And this is important because there are three reflexes which are extremely important. The first one is to swallowing. That is a reflex that helps us to get food and spit and all those other things into our stomach and not into our airway. Another really important reflex is coughing, and also the gag reflex. When you cough, you can how do you say it? You can spit something out. You can eject whatever is stuck in your airway. And so coughing is really important. But I think the most important reflex out of these three is muscle tension. When we're unconscious, then we don't have any muscle tension. And usually we always have some sort of muscle tension, even when we're sleeping. And this is why, as you learned in the videos before, why our patient can, like, swallow his tongue, I guess. Because he has no muscle tension, his tongue can block his airway. Now, as we learned, we can deal with this loss of reflexes by simply tilting his head backwards, and that way he won't swallow his tongue. However, what can we do if we're alone and we don't have anyone to help us keep our patient's head tilted back? In that case, there's a really cool medical device that is called an OPA, or you can also say airway. That's how I called it in my previous course, but generally the name is OPA. And an OPA is a little device that we can insert into the patient's mouth in order to keep his airway open, in order to improve the airflow, and lastly, to make sure that his jaws, they will not lock. Okay, so when do we want to insert this little thing? Basically, we would always want to insert this into a patient who is completely unconscious, because he has no reflexes and he can't gag this thing out. It's not gonna make him vomit. If a person has some reflexes, so basically he is reactive to voice or he is reactive to pain, then that is a gray area.
The reason why it is a gray area when a person is vaguely conscious is because we can't really know which reflexes our patient lost and which reflexes he still have. And so, in situations where a patient is vaguely conscious, we will not insert the OPA device. We will only insert the OPA device in patients who are completely unconscious.
Also keep in mind, if we inserted this into our patient's mouth and he gagged it out, he puked it out, we will not try to insert it again. Okay, that means he has his gag reflexes and we will not try to insert this. However, if we inserted this and slowly we can see that his mouth is getting filled with puke, because this thing doesn't stop his mouth from getting puke in his mouth. So if that is the case and we see that his mouth isn't clean, we will stop whatever we're doing. We will take this thing out. We will clean his airway like we learned, and then we will insert it back in. And that is basically how you use an airway. Now let's learn how to insert this properly. Okay, so hey, say hi to Michael, my model for today. Now, the way you want to insert this thing is you want to measure if this is the right size before you insert this in his mouth. Now, the way you do this is, can you move to the side? Yeah. The way you do this is you want to take the front of your OPA device and you want to put it right where his lip ends, okay? And what you want to see is you want to see if the end of this OPA device, if it stops where his chin stops, right below his ear. Okay, so you take this, you put it where his lip ends, and you want to see if it stops right below his ear. Let me try to do this in a way that you will see. There we go. So as you can see, this is the correct size. This is maybe a tiny bit too big, but it seems, actually, no, it seems exactly the correct size. It ends right where his jaw ends, and it ends below his ear. This is how you measure if this is the correct size. Now, how do we actually insert this? Don't worry, I'm not gonna abuse my model for today. I'm not gonna try and insert this while he is conscious and awake. We're gonna hit him in the head first and make sure he's unconscious. I'm obviously joking. What we're gonna do is I'm gonna show you on the outside how you insert this. So the way you do this is you want to first open his mouth and tilt his head backwards like this. And then what you want to do is you want to insert it upside down. So you don't want to immediately insert it like this, like this in his mouth. You want to have it upside down, and then you want to insert it halfway in when it's in the upward position, and then you turn it around. Okay? So I'm going to show it one more time. You want to insert it halfway in upwards, and then turn it around inside of his mouth while his head is tilted. Now, the reason why you do this, you can close your mouth. The way why you do this is because you don't want to shove his tongue down his airway. Obviously, this is supposed to guard his mouth from him not having to swallow his tongue. So what we want to do is we want to make sure that we have it upside down, and that way we will not shove his tongue. And honestly, I would also recommend that if you can, that when you shove this, you will be really careful not to push his tongue inside. And also, if you want to, or if it's an option, you don't have to do this, but you can even grab the tongue with your thumb and hold it in place while you insert this device. That is how you insert the airway device, and that's basically it. It's a really good device. It's not a perfect device. He still can have puke going up in his mouth, and if his reflexes are back, then he can vomit this out, which is not ideal. It's not good. But again, if you are alone and you're by yourself and you can guard his airway using this, then it's amazing. So keep this in mind if you're building your first aid kit. I really recommend carrying an OPA device. Okay, so that was it for the OPA device. Keep in mind there's a bunch of different first aid equipment that can be really helpful. There's also an NPA device, which is like the OPA, but we insert this in the nose. The upside is that it doesn't create the gag reflex at all. However, the downside is that it's harder to insert and it takes more time. So it's not ideal in situations like CPR where it's very time sensitive. You also need to apply lube on an NPA device to apply it to actually succeed to apply it. So I personally recommend using OPAs and not NPAs. There's a lot of other devices that can be really helpful. For example, the suction device. As you probably guessed, cleaning a patient's mouth from puke is not ideal if you're using your fingers, and you probably won't be able to get all of his puke out. So using a suction device can be really helpful, and obviously an AED, a defibrillator, can be a lifesaver in situations like this. I know that currently, statistically, only around 6% of CPRs actually used an AED, which again, it's shocking when you consider the amount, like how helpful an AED is. So grabbing yourself some first aid equipment can be really, really helpful. I'm gonna create a bonus lecture at the end of this course. It's going to be the very last lecture where I'm going to give you guys some links to some recommended first aid equipment that I think can be really, really helpful in situations like this. That's it for this video. I hope you guys enjoyed, and I'll see you in the next one. Bye guys.